Again, with the launch of the Learning and Development Strategy, we tried to put it succinctly that at the end of the day, the service that we are delivering, both as a vet provider or as an industry provider, is geared towards the person with a disability. And then the range of systems that need to be in place. I think the message that came from Minister Treasurer Brumby was, if it's not sustainable, then obviously government need to look at the sustainability of organisations to deliver a framework. And I think you will find that, I know in health, and I suspect this will be the same in community services, that if we do not have the sustainable practices in place to deliver that service within a costed arrangement, notwithstanding, are we heading towards a quasi-regionalisation of services, looking at creating efficiencies around costing and providing of services. But notwithstanding, there are a number of synergies around the recruitment and retention of staff within this area, building on training agendas based around the needs of an individual. And again, I think we're starting to see more conversation arise with providers, with the vet industry, around aligning a practice to competencies, but underpinned by the identified needs of individuals within your industry. So let's put it into context. Why do we do workplace learning? And how do we do it? And what is the beneficial outcome? It's interesting that we are the disability sector, as with the health sector, as it talks about principles around support, principles around encouraging growth, principles around inclusion. Those same principles should be put in place for our workforce. And again, we need to move beyond, and I think it was the previous presenter put it quite succinctly, around engaging that workforce and forming that partnership. Health promoting organisations, and I'll talk a little bit about this in a moment, where Vic Health spoke about if a disability support organisation or a health support organisation is talking about the health and well-being and the support needs of their community, they should not disinclude the community of practice that actually is their workforce. The induction processes. Now again, working with organisations, that first view of an organisation is a meaningful view. We've engaged this person to have a trial with our organisation. How do we actually open the door, and how do we actually lead them through those first stages within their organisation? And this is where I know from the Department of Human Services, but also a range of larger providers, have actually fine-tuned their induction processes. And again, an innovative model has been the creative of induction systems that actually are linked to units of competency from a community services package. So you're actually front-ending an opportunity for a person to engage in your organisation, become a part of a community of practice, but at the same time start to look at engaging in a learning environment, in which then organisation, we hope, starts to think about itself as a learning organisation. I mentioned before about the DHS leadership program. 1,200 staff across all regions of DHS in the disability services sector over 4 years. And it was part of their, not so much recruitment process, but it was their retention processes, that they were mindful that they noted from their climate surveys that there was a lack of support in leadership and a lack of support in learning systems to support leadership. Over that 3 years, RMIT, in a consortium with a range of other vet providers, we identified units of competency, leadership units of competency, from the Advanced Diploma of Disability work qualification, and through building of curriculum, delivery of workshops, and then assessment processes that were linked back to the development of evidence portfolios that was embedded from a matrix against those units, and project work that focused in on quality. In a review with the Training Implementation Committee with the Department of Human Services, we were able to put a cost value on that training. So there was actually a return on investment over those 3 years that the projects that actually had been developed had been costed as something like 60-70% return on that investment back to the organisation, notwithstanding giving the conversations and the legislative requirements around building quality. It also fed into the quality framework of DHS, which I know we're going to be hearing more about this morning. And then the development and supervision models, and that was the other area which we concentrated on. Again, it came out in this morning's presentation that as we move forward with our workforce, we need to have a system where it's not punitive, not hierarchical, but an engaging equity focus with workforce. Can we have a conversation with workers around their training needs? Can we have those conversations around where they see those training needs linking into the broader strategic needs of an organisation? Can we then, and HR I'm thinking of here, can HR then use that information to start building realistic, costed training plans that actually have achievable outcomes, both for the service user and also the organisation? Again, my view of workplace learning is in respect to that, what is the desired outcome of the individual? And we cannot even attempt to guess that until we have those informed conversations. But then can we start mapping those desired outcomes to the strategic needs of those organisations? Can we take a broader view of an organisation and where an individual fits within that organisation, and can we support that individual to chart a course of engagement that we hope is a rewarding and fulfilling involvement with that organisation? I mentioned before about Vic Health, and in a study in 2005 they identified that and this was obviously a study that was quite far-reaching across not just the health and community services industry, but also industry in general in Victoria. But it was interesting to note that the 3 points that that came out of their research: training that needed to be well planned, and the induction processes need to be well planned, that we need to get off on the right foot with workforce, and that it needs to be a flexible and family-friendly training. So again, not punitive in the sense you must turn up today, you must engage on this day. Can we have a conversation about what you and the organisation can come to an agreement on what we think your training needs are, and how can we best deliver those training needs, working within the uniqueness of the workforce as well as the service users. The other areas that Vic Health identified was around performance management. And again, given there's a number of HR professionals in the room, I think you would agree with me that nothing challenges the notion of leadership management is about managing performance, especially in an environment where without the appropriate skills to manage that performance issue, there tends to be a tendency to internalise performance, and then you start to see workers put on the outside. And then that whole notion about where does managing performance fit within professional development. And then finally, Vic Health, which I would have note that they spoke about the development of new skills, and go back to the start of my conversation here this morning, in which out of the COAG report, out of the various drivers from the ministerial statement at a Victorian level, there is a strong view towards skill sets. And within skill sets, we're starting to talk about partnership, we're starting to talk about team building, and we're starting to talk about communication. Underpinning all that is about how, as an organisation, we seek to look after an individual's health and well-being. If we are support organisations and we truly believe in our vision and our mission around supporting communities in Victoria, we should not forget that our own workforce is part of that community. And then also it's about having workforce workforce understand about sharing and nurturing the support of others around them. So having that community of practice approach.